The most common challenge with our senior patients, honestly, is that so many of them have no one. So many of them don't have families. Or one lady said to me, "I'm the only one left. All my friends have passed away. They're all gone." First time I walked into Betty's house, I did an assessment.
Hey, Betty. How are you?
She's a self-proclaimed homebody. She didn't want to go anywhere.
Good to see you.
Yeah, good to see you too.
Thank you.
Seniors can become increasingly isolated. And while we want to make sure that we support them in their homes, we also want to make sure that we help them get out and into the community and engage in ways that help them reconnect with what makes them feel vital.
Are you aware you have access to care transportation?
Traditionally, case management, care management has had a very medical focus. I think it's now a much more holistic focus. So we want to look at the medical, the behavioral, and social determinants of health. So that case manager uses the information they can glean from our claims as well as conversations with the member to help understand their needs across all those different dimensions, whether it's support for chronic conditions, their pharmacy benefit, accessing good nutrition, transportation, support in their home. They can help them leverage their benefits as well as community resources to meet all of those needs.
There are so many different programs that people aren't aware of. And a lot of times they're just sitting in their house thinking that no one cares about them. And that's not the truth. She wasn't aware of the Silver Sneakers benefit. And when I talked to her about it, she was very resistant. She was afraid that she would be embarrassed. She said, "I'm not coordinated, I can't do this." So it took quite a bit of prodding. Okay?
Okay.
All right, good.
Once I got started, I really enjoyed it. Like I go twice a week. And my neighbor friend up the road, she decided she'd like to go.
Social isolation is truly, it's a crisis for a person who doesn't have anybody to talk to, laugh with, maybe share a meal with. But aside from that, they then would go into a mode of depression.
We want to make sure that people have a sense of purpose in their lives and a sense of belonging and a sense that they are continuing to contribute to society.
We have so many assets that we can use. We get them involved, get the Area Office on Aging involved. There are senior newspapers, things like that. We just bring these benefits to the member and say, let's get you involved in something.
I love to volunteer. I always did. And it gives me something to do, keeps my brain active. I volunteer at the church one day a week, and I just thank God that I'm able to do this. It gives me a chance to get out and do something worthwhile.
I'm so proud of Betty.
Are they?
She is a much more social person than she was, and this has nothing to do with me. It has everything to do with her. She finally decided that she was going to do it.
What do I think about Sarah? She's an easy person to love.